Hi everybody, Wendy Redinger here. I just wanted to touch base today with any personal trainers or that are thinking of working with special needs, or any caregivers that just have no idea really what to do to get patients who have Parkinson's disease to be able to exercise. I've been a trainer for over 17 years and I have a nursing background, so I'm very familiar with Parkinson's. I, 2 years ago, started to take on more cases of Parkinson's when I moved to Florida. And so I have experience working with mild Parkinson and more severe Parkinson. And for those who don't know, Parkinson's is a neurological disorder of the central nervous system, and it impacts movement. You might see things such as tremors or freezing, like they could be walking and all of a sudden just freeze in place. They could suffer from contractures, which the joints they can't extend fully. They're just kind of contractured into a bent position. And so you're going to notice, like in mild stages of Parkinson's, they may have some ambulatory issues, maybe some mild freezing. You might notice some muscle imbalances, things like that. And then the more severe it gets, you're going to have more increased risk of falls because the feet don't lift as high. They're dragging their feet more, shuffling, and that can lead to more falls risk. So the important things to focus on when you're working with Parkinson's is you definitely want to work on balance, whether you have them in front of a counter or a table. You want to work on stretching because of the contractures. So you need to start working on the range of motion, increasing that range of motion. And it's a constant thing. It's not going to stop. You don't do it one time and you're done. You also want to work on strengthening because, of course, the legs dragging and the feet shuffling means they're weak. And so you have to build the leg strength up again, but you also have to build up the upper body because if you have a fall, you want to be able to push yourself up. So there's lots of different areas to work on here. My first session with a severe Parkinson's was a really learning experience. And I say that because in my head, when I first started working with him, I thought that placing him on fixed weight machines would be the best option because he'd be able to sit down, which he complained he had issues standing up all the time. And I thought sitting in a machine would be the easiest way of managing. Well, I was completely wrong because he froze up on the machine, and then it took about 5 minutes to get him off the machine. And so I had to lift his legs, and we kind of had to work together, and we laughed about it because he understands where we are, and everything's trial and error when you're first starting to work with Parkinson's, depending on the severity of it. And so we kind of worked on it together. And we figured out that like an incline bench or a chair or a plyo box was the best option to sit on, and using dumbbells, cables, and bands. So that's what we focus on when it comes to cardio, basically walking. He will use a treadmill at a very, very slow pace, and he hasn't froze up on the treadmill, but we do attach that safety on him in case he has any issues. But so far so good, and he feels good about it. And that's the thing, you have to communicate all the time with them. But the thing I want you to know is you have to let them be as independent as possible, because you have to remember their life has completely changed. Somebody who ran a normal life, a normal business, has their family, and all of a sudden their body just doesn't want to cooperate with movement. And so you have to let them be as independent. And I'm kind of like the person who stands there and cheers them on when they're exercising. And that's what you want to do. You want to be the person that you console them when they're kind of having like a depressed moment. And you have to be ready to help lift their spirits up and say the right thing. Like, it's okay, I'm here to help you. Always stay positive with them. I always stay on the upbeat side. I always see the positive. And when they hear that in your voice, it uplifts them and it makes them feel like anything is possible. And just always encourage them. Always stay encouraged. I know sometimes it can be frustrating when families are on a daily basis, dealing with the issues that come along with Parkinson's, but you always have to be encouraging and trying to stay as positive as possible. So hopefully this will help you with your business a little bit, and I'll be giving, different exercises along the way that work too. All right, bye.